The olfactory nerve, sense of smell damaged caused by impaired sense of smell. Optic nerve, provides vision. Damage causes blindness in part or all of visual field. Oculomotor nerve controls the muscle that turns the eyeball up and down immediately, as well as controlling the iris, lens, and upper lid. Damage causes drooping eyelid, dilated pupil, double vision, difficulty focusing, and inability to move in certain directions. Trochlear nerve, eye movement, superior oblique muscle. Damage causes double vision and inability to rotate eye infralaterally. Trigeminal nerve, largest of the cranial nerves, the most important sensory nerve of the face, forks into three different versions. Abducens nerve, provides eye movement, lateral rectus muscle. Provides eye movement. Damage results in inability to rotate eye laterally and rests eye rotates medially. Facial nerve, major motor nerve of facial muscles, facial expression, salivary glands, anterior nasal and palatine glands. Sensory, taste in anterior 2/3 of tongue. Damage produces sagging facial muscles and disturbed sense of taste, no sweet and salty. The vestibulocochlear nerve of hearing and equilibrium. Damages produces deafness, dizziness, nausea, loss of balance, and involuntary rhythmic association with eyes to side. Glossopharyngeal nerve. Swallowing, salivation, gagging, controlling of blood pressure and respiration. Sensations from posterior 1/3 of tongue. Damage results in loss in bitter and sour taste and impaired swallowing. Vagus nerve, most extensive distribution of any cranial nerve. Major role in the control of cardiac, pulmonary, digestive, and urinary function. Swallowing, speech, regulation of viscera. Damage causes hoarseness or loss of voice, impaired swallowing, and fatal if both are cut. Accessory nerve, swallowing, head, neck, and shoulder movement. Damages cause impaired neck, head, shoulder movement. Head turns towards injured side. Hypoglossal nerve, tongue movements for speech, food manipulation, and swallowing. If both are damaged, cannot protrude tongue. If one is damaged, tongue deviates towards injured side. See ipsilateral atrophy. Cranial nerve disorders, trigeminal neuralgia, recurring episodes of intense stabbing in trigeminal nerve area near mouth or nose, pain triggered by touching, drinking, washing face. Treatment may require cutting nerve. Bell palsy, degenerative disorder of facial nerve causing paralysis of the facial muscle on one side, may appear abruptly with full recovery within 3 to 5 weeks. Major landmarks of the brain: rostral, toward the forehead; caudal, toward the spinal cord. Brain weighs 1,600 grams in men, 1,450 in women. Major portions of the brain. Cerebrum is 83% of the brain volume. Cerebral hemispheres, gyri and sulci, longitude fissure, corpus callosum. Cerebellum contains 50% of neurons, second largest brain region, located in posterior cranial fossa. Brainstem is the portion of the brain that remains in the cerebellum and cerebrum are removed. Dicephalon, midbrain, pons, and medulla oblongata. Longitudinal fissure, deep groove that separates the cerebral hemispheres. Gyri are the thick hills, sulci are the shallow grooves. Corpus callosum is a thick bundle of nerves at the bottom of the longitudinal fissure that connects the hemispheres. Occupies posterior cranial fossa, marked by gyri, sulci, and fissures. About 10% of the brain volume, contains over 50% of the neurons. Brainstem, what is remained when if the brain cerebellum are removed. Gray matter, the seat of neuron cell bodies, dendrites, and synapses. Dull white color with fresh due to little myelin. Forms surface layer cortex over the cerebellum. Forms nuclei deep within the brain. White matter, bundles of axons, lies deep to cortical gray matter. Opposite relationship in the spinal cord. pearly white from myelin around the nerve fibers, composed of tracts or bundles of axons that connect one part of the brain to another and to one spinal cord. Meninges, 3 connective tissue membranes that envelop the brain, lies between the nervous tissue and bone. As in the spinal cord, they are the dura mater, arachnoid mater, and the pia mater, and protect the brain and provide structural framework for its arteries and veins. Dura mater in the cranial cavity has 2 layers: outer periosseal, equivalent to periosteum and cranial bones. Inner meningeal continues into the vertebral canal and forms dural sac around the spinal cord. Cranial dura mater is pressed closely against cranial bones. No epidural space, not attached to bone except around the foramen magnum, sella tertia, the crista galli, and the sutures of the skull. Layers separated by the dural sinuses collect blood circulating through the brain. Arachnoid mater and pia mater are similar to those in the spinal cord. Arachnoid mater's transparent membrane over the brain surface, so subarachnoid space separates it from the pia mater below. Subdural space separates it from the dura mater above. Pia mater is a very thin membrane that follows the contours of the brain, even dipping into the sulci. Not usually visible without a microscope. Meningitis. Inflammation of the meninges, serious disease of infancy and childhood, especially between the ages of 3 months and 2 years, caused by bacterial and virus invasion of the CNS by the way of the nose and throat. Pia mater and arachnoid mater are the most affected. Bacterial meningitis can cause swelling of the brain, enlargement of the ventricles, and hemorrhage. Signs include high fever, stiff neck, drowsiness, and intense headache. May progress to coma and then death within a few hours of onset. Diagnosed by examining the CSF for bacteria. Lumbar puncture is a spinal tap which draws fluid from the subarachnoid space between the 2 lumbar vertebrae. The medulla oblongata has 4 different centers. Cardiac center adjusts the rate and force of the heart. Vasomotor center adjusts the blood vessel diameter. Respiratory centers control rate and depth of breathing. Reflex centers for coughing, sneezing, gagging, swallowing, vomiting, salivation, sweating, movements of tongue and head. Metencephalon develops into pons and cerebellum. Pons, anterior bulge in brainstem, rostral to medulla. Cerebral peduncles connect cerebellum to pons and midbrain. The cerebellum has the 4 lobes and then one other thing. The frontal lobe, volunteer motor functions, motivation, foresight, planning, memory, mood, emotion, social judgment, and aggression. Parietal receives and integrates general sensory information, taste, and some visual processing. Occipital lobe, primary visual center of the brain, temporal lobe, areas of hearing, smelling, learning, memory, and some aspects of visual and emotion. Insula, hidden by the other regions, understanding spoken language, taste, and sensory information from visceroreceptors. Lymphatic system. The limbic system, important center of emotion and learning, gratification, and aversion. Most anatomically prominent components are hippocampus in the medial temporal lobe, memory, amygdala, immediately rostral from the hippocampus, emotion. Emotion is feelings and memories are interactions between the prefrontal cortex and the cytocephalon. Prefrontal cortex is the seat of judgment, intent, and control over expression of emotions. Feeling comes from the hypothalamus and the amygdala. Nuclei generated feelings of love or fear. Behavior is shaped by learning associations between stimuli, our responses to them, and our reward or punishment that results. Primary sensory cortex, sites where sensory input is first received and one becomes conscious of stimuli. Association areas nearby to sensory areas that process and interpret the sensory information. Primary visual cortex is bordered by the visual association area, interprets and makes cognitive sense of visual stimuli. Multimodal association areas receive input from multiple senses and integrate this into an overall perception of our surroundings.